Today we're going to be talking about social anxiety in Germany, and our group is Maggie Riggs, Nick Leymeister, Mackenzie Camarota, Hayden Burns, Lily Cleveland, Madison Moreland, and Michaela Cruz. To start off, social anxiety is a chronic mental health condition in which social interactions cause irrational anxiety. People with this disorder have trouble talking to people, meeting new people, and attending social gatherings. They fear being judged or scrutinized by others. Now, to give some basic background about Germany, the capital is Berlin. The population is 83.2 million. Their official language is German, and Germany is actually one of Europe's largest countries. And now included in these pictures are the German flag, the Capitol building, an aerial view of the downtown area, and some traditional wear in a seemingly traditional German village. Now, to give some background on the cultural norms and just overall mental health culture in Germany, Germany leads Europe in its commitment to treating mental illness by providing financial support for patients, access to healthcare services, help finding or staying in work, outreach programs, and awareness campaigns. Psychosocial counseling centers offer help for a variety of issues, including family, women, childcare, and addiction. In Germany, they are run by local health authorities and can be used for free by everybody. They particularly support people who need treatment for acute or chronic mental illnesses. In addition to this, many German universities and careers provide psychological care and support for students and faculty.
So, some more background. Before the term anxiety was first used, many people just accounted the feelings of anxiety as stress or nervousness, and because of this, a lot of people went untreated, and it started rising in the amount of cases that they saw. And when they started diagnosing people with anxiety, they usually only did it for adults in their later life, so leaving children and teenagers with a lot of feelings of nervousness and stress. And then another cause for social anxiety is also related to the cultural norms in the country. Germany usually prides themselves upon privacy, keeping information to themselves, so even sharing these feelings of anxiety was hard for most people.
So, statistics on social anxiety in Germany. The main study we're using is from 2005 to 2016. We have some reports on the COVID studies, but they're not in yet. Social anxiety rates have spiked up since then, but since they're not finalized, we're just going to talk on pre-COVID. Studies have found that 1 in 6 students in Germany suffer from a form of social anxiety. With this information, it's estimated that there are a total of 470,000 students suffering from social anxiety or a related mental illness in that area. Along with that, from 2005 to 2016, instances of mental illness just by diagnosis alone have increased by 38%. Out of 76% of that, it's shared with depression and social anxiety. Those are the leading spike. Okay, so the main test that was used on the German population was the IAS, better known as the Illness Attitude Scale. Can't really zoom in more for you, but the one on the right is obviously a representation of what they'd see, and the one on the left is in English. Those who took this test, it was provided for them by the study, would be given sets of questions to judge both their quality of day-to-day life, along with gauge off their answers, just how at risk they were for certain illnesses. It would be like, how much does the thought of death scare you? How much does the thought of a family member passing scare you? And then just questions on quality of life. This has been used worldwide, but specifically in Germany, they've been using it since 2004.
All right, so for the solution, we're planning on providing an abundance of therapy institutions that are easily accessible to young adults and adolescents alike. And the treatment that we're planning on doing is it's called psychotherapy, and then proceeding from that, we would change with exposure-based CBT, which is cognitive behavioral therapy, when that's appropriate for the person, because cognitive behavioral therapy is pretty much just bringing them out to their anxious-based needs and having or fixing their coping mechanisms and everything like that. And then we're planning on having group therapies in schools during breaks that are easily accessible to kids and teens alike. And then if it's too severe for these therapies to help people, we're planning on doing biomedical therapy, which is just medication or herbal supplements based on the severity of the person, and then based on the personality of that person specifically, like after assessing their personality and everything, you would go ahead with either an SSRI, which is a serotonin-based anxiety medication, or an SNRI, which is going to help with serotonin levels as well as norepinephrine levels. And then for the approaches, there's 3 different approaches that go with this. So there's humanistic, which is the psychotherapy part of it. It pretty much teaches children and adults alike how to change and create a better life for themselves, to change how they feel negatively. The cognitive part of that is obviously the cognitive behavioral therapy, which is training the brain to overcome their fears and improve their coping skills. And then biological is the medication. It inhibits and reduces the levels of norepinephrine while increasing the levels of serotonin. It's pretty much making the brain reabsorb all of the serotonin to lower anxiety levels, and it gets rid of the norepinephrine to decrease the fight or flight that people feel from the norepinephrine creating their anxiety.
What's planned for today are 2 techniques. One is going to be a method of exposing yourself to anxiety symptoms, bringing them on so that you can learn what they feel like and learning to bring them down again.
Okay.
How does that sound?
Not great.
It's a tall order.
Yeah.
Very effective though. And what's going to make it easier is that we're also going to learn a breathing technique that we really use to bring those symptoms down.
Okay.
Okay, and that's
better.
It does for most people.
Okay.
So I'd like to try that first, this relaxation breathing technique.
Okay.
Okay. One of the reasons we like this a lot is that, first of all, it's portable, easy, can be done anywhere. So you can use it for all kinds of things, not specifically limited to when you have panic symptoms. The other thing about it is that it really directly gets at one of the core symptoms of panic. And that is that when you're feeling panicky, you're probably breathing a little too rapidly.
Okay.
Have you ever thought about your breathing and what happens when you're anxious?
I just can't catch my breath.
And what do you think you're doing when you feel that way?
I'm more than likely holding my breath because I'm panicking.
Right. And then in response, chances are you're probably breathing a little too quickly.
Oh, you're right.
That's one of the characteristic things people do.
Okay.
That and the breath holding, you're absolutely right. They're both big issues. The problem is that, ironically enough, both those patterns are going to contribute to even more physical symptoms that you then think of as part of your core anxiety symptoms.
Okay.
Okay, so we need to identify those and begin to get more familiar and comfortable with them.
How you think about something affects how you feel about it. How you feel about someone affects how you behave towards them, and so on. The issue for clients with anxiety is that we cannot control our feelings or our emotions directly. And because all of these things interact with one another, by changing how you think and how you behave, you can actually help people to feel differently, which is the ultimate goal of this kind of therapy.